And here to answer all of your medical questions at our Ask the Doc segment is Dr. Msonthi Levine. So in this study, do you think these people that are conducting this study actually have kids?
I don't know. I would have to wonder. I mean, that's very, very controversial. Certainly not the environment I grew up in. You know, what are you to do when you have a kid that's not behaving? I think we would culturally have to be taught all over again what to do, because I'm sure a lot of parents out there are going to some sort of physical punishment. I know you can go overboard with that. We're certainly not condoning anything like that. But certainly that would be a whole new paradigm to listen to people about what to do with kids when they're not behaving correctly. So I'm looking for more and more studies to see how that's working out, because as you know, a lot of these studies initially say one thing, and then with future time it says another thing. So that would be difficult for me. I don't have kids.
This one has always been a controversial issue.
And I think it will always be. I think in terms of not spanking has won a lot of people over. You see in the schools, it's no longer, you don't have any of those issues. But the kids, you know, talking with teachers, you know, I have some teachers that are my patients, you know, things have changed. They feel like they've lost some control of the classroom. They don't have a lot of support like they used to have. It's like the kids are untouchable. And certainly when you're trying to discipline someone who's growing up, that can be quite difficult to then teach them mathematics and English. You know, we're looking for a better system. I think it's still broken, and I think we still need to keep watching and looking to see how to figure this out.
And we're not talking corporal punishment by any stretch of the imagination.
Absolutely. We just need some way of trying to figure out how to teach the kids what to do, what's wrong, what's right. Again, not condoning a lot of physical abuse, because we know there's a lot out there, and that's not anything that we want to see. As physicians, we're always coached to look for physical abuse, so not condoning that at all. But very controversial topic, absolutely.
And of course, something else you do have to remember is with each child is different, so your course of action that you take with one child is going to be different with the other child.
Absolutely. I grew up with that as well, different personalities, so one thing works better with another child. Just have to talk with the pediatrician, be sure and educate yourself as parents. There's a lot of education out there, online books, etc., talking with your family, etc. So you're not out there by yourself.
All right, talk to other parents as well. On to some of our viewers' medical questions. This person asked, does long-term use of Depo-Provera shot cause bone loss?
As far as I know, no. That's a hormone. It should help with bone growth or a bone preservation. Certainly menopause, which is when hormones are absent, that tends to be a big reason for bone loss. So as far as I know, there shouldn't be a problem with prolonged use of that causing osteoporosis.
Okay. Why was it okay for doctors to implant mesh after the lawsuit cutoff date?
Well, I think there are other forms of mesh, other manufacturers of mesh. I think there was one particular mesh that was involved with the lawsuit, so a physician just kind of goes to a different mesh that's not under the lawsuit. We face it a lot with medications. When medicine's under a lawsuit, we just kind of switch our habits, so that's probably what the issue was.
This person has been having problems with very low blood pressure, and their doctor doesn't seem concerned. Sometimes it feels like she's going to pass out and not come back. It's kind of scary. Do you have any suggestions as to how to raise the blood pressure a little bit?
We have some medications out there. One in particular is called Florinef. We use that sometimes when a person has proven passing out, or what we call syncope episodes related to documented low blood pressure. Certainly making sure no thyroid illnesses, no anemia, no heart or neurological issues, but this medication works very well. So maybe talk with your physician about prescribing that.
All right, we've got lots of other questions. We'll get to those in just a minute. So don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says, is a urinary tract infection common for elderly people?
Oh, big time. You know, just because elderly patients a lot of times have fallen bladder, they have menopause, they have diabetes, just a lot of issues that promote bladder infection, so it is very common.
I had a baby in January, not me, but this person, but my tummy is still bloated as if I'm in the early stages of pregnancy. Someone brought up muscle separation. Are there exercises or binders, or is surgery my only option?
I think all those things are possible. I would just probably be patient. A lot of times the physical changes with pregnancy take a while to go away. Certainly regular exercise, making sure you're not overeating and over drinking are some good things to remember. But certainly if you're not happy with your body, certainly can talk with the surgeon later on about maybe changing some of those things.
Just look at that end result and think of how proud you are.
Absolutely. It sometimes costs a lot of money though to do that, and then the dangers of another surgery. So I would just be patient with that issue.
What are the chances of surviving a silent heart attack?
You know, there are some people who don't feel like there is such a thing as a silent heart attack. It's more of an ignored heart attack. A lot of times we have symptoms that might be a heart attack, but we blow it off, and then later on we go in for an examination. And oh yes, by the way, do you know you had a heart attack at some point? So some people feel like there is no such thing, but typically it's going to be a milder heart attack, so certainly something patients tend to survive and go on with their life, which is kind of why it's named like that. Certainly there can be more severe heart attacks where you die suddenly or you pass out or have a lot of shortness of breath and swelling. So probably yes, on this issue you survive typically.
Do you lose any percentage of your heart muscle whenever you have a quote-unquote silent heart attack?
I would say silent would have to be a small one, so probably not a significant amount, but certainly a small percentage, because that's what a heart attack is, muscle death. So certainly a percentage, but probably not enough to make a difference, which is why it's kind of called silent or ignored.
This person has a question. I feel like a cramp in my head, like when I turn my head, I hear and feel the noise. Does this have something to do with allergies and sinus?
Well, typically allergies and sinus don't cause a lot of cramping, maybe pressure, maybe some runny nose, some sneezing, facial tightness, but not those typical symptoms of pain.
And do we have a lot of allergies type things blowing around in the air? I notice a lot of sneezing, coughing going on.
Cold and flu season right now. Certainly the March, April, that's the yellow dust season. That's when we see a lot more allergies. But you know, allergies are always going around. We spend a lot of time indoors. A lot of people seem to be sensitive to a lot of those things. So they're always going around, absolutely.
When's the best time to get a flu shot?
Flu shot now until next year, about February. We have 3 or 4 different varieties. We don't really care which one you get. Just get one of them. They're more available a lot sooner. It tends to last the entire flu season. I know some people have been a little skittish about not getting it too early, but yes, time is now. Go ahead and get it. It's available.
So call your doctor and...
Some doctors' offices do it, but some don't. Like I've never offered that in the office. It's very problematic to get that done in the office. So a lot of the pharmacies are doing it now. I haven't heard any bad things from patients who've gotten it from the pharmacy. It seems to be a good deal.
You can't get the flu from getting the shot, right?
No, absolutely. Sometimes some people have side effect. They feel achy, maybe dry cough, but it is not the flu.
All right, Dr. Levine, as always, we appreciate you taking the time.
Yes, ma'am.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us at laf@kftm.com or post those questions every Monday on our KFTM News Facebook page.